Nurses often see themselves as invincible givers, feeling that they must be able to give themselves completely to their patients without showing any signs of stress, fatigue, or depression. Nurses are awesome, but we have to deal with a lot of things, from the good to the real ugly, from taking care of a difficult patient to silencing the boisterous IV machine, to sicking a patient to negotiating with doctors. We do it all, or it seems like we can do it all, but that's not always the case. Nursing is a stressful job, and sometimes we get too stressed. Prolonged stress can cause burnout. But burnout is not just stress, as stress is situational, and burnout lasts and lasts and lasts. Nursing has an asymmetrical relationship. It's a job where we give, and the patients take, and take. So it's not we're weak or incompetent. Anyone can experience burnout. Although it's very similar to depression, fatigue, or anxiety, it's actually a whole different bundle. Burnout is characterized by 1. Emotional exhaustion. Much like how a car runs out of gas, nurses can run out of emotions. Depersonalization. Being overtly cynical and detached. Reduced personal accomplishment, which is negative feelings about oneself or the lack of enthusiasm. But all these three characteristics lead to physical or psychological distress. It leads to our inability to care for our patients, have empathy, or even perform basic nursing skills. We become indifferent or numb to our patients. But the question is, how does burnout affect us? It's important to first explore the causes of burnout and the risk factors that influence it. There are both personal and environmental risk factors that have been found to contribute to the cause of burnout. Some personal risk factors include age, gender, race or ethnicity, family status, educational status, and personality traits. One example is how burnout is less prevalent among older nurses since they have more experience and tend to be more stable with a balanced perspective on life. Another example would be how individuals who are married and/or have children are also more susceptible to burnout. It was found in several studies that various personality traits like a low self-esteem or lack of confidence, a drive to overachieve, selflessness, impatience, and many others can also increase the susceptibility for burnout. Some environmental risk factors include work overload, lack of fairness, lack of control, conflicting values, and lack of reward. The impact that burnout has on nurse health ranges from physical manifestations like exhaustion, hypertension, insomnia, and lack of self-care to psychological ones like anger, guilt, frustration, and emotional detachment, and even addictive behaviors. Here is a list of some of the symptoms and effects on health that burnout can cause in nurses. It's clear that nursing burnout can have a great effect on the health of nurses. These symptoms and manifestations can then contribute to a negative impact on the quality of patient care.
As fellow nurses who are all about patient-centered care, you may now be asking yourself, how does nurse burnout affect how I care for my patients? The first and most important issue that should come to mind is patient safety. Nursing burnout is a critical predictor of patient safety. A well-put statement from an article published in the International Journal of Nursing Studies in 2010. Nurses who have a high degree of burnout have a decreased ability to cope with stresses in the workplace and have a decreased memory capacity that can lead to medication and treatment errors. A second issue correlated to burnout puts patients through unnecessary treatment. A study looking at the rate of hospital-acquired infections suggested that both urinary tract infections and surgical site infections were correlated with high nurse burnout. These adverse events cost the hospital millions of dollars each year. This study suggested that by reducing burnout from a 30 to a 10% prevalence, a cost savings of $69 million could be attained for that particular hospital system. Not surprisingly, after searching the literature, there are plenty of studies that suggest all aspects of patient care suffer when a nurse reaches a high amount of burnout. I'm talking about physical, emotional, psychosocial, and spiritual care. Unfortunately for hospitals, it has been found that decreased patient satisfaction due to nurse burnout leaves patients with a poor opinion of the hospital and therefore less likely to recommend it to family and friends. Other issues surrounding nurse burnout is the employee cost to the hospital. Employees who have a history of being late or absent have a higher rate of burnout, which costs the hospital money, is not conducive to a positive team environment. Multiple studies show that the turnover rate is higher in nurses with a high degree of burnout. This leads to difficulty in recruiting and retaining staff. All in all, the cost of nursing burnout is too high, but what can be done?
Now that we've had a good look at what burnout is and how it affects the nursing profession, let's take a look at what we can do about it. There are a number of personal interventions that we can apply. Self-care is perhaps one of the most important components of preventing the physical aspects of burnout. Self-care means eating healthy and regularly, getting enough sleep, and getting exercise. Also, take time to do things that help relieve stress for you, like yoga, meditation, listening to music, playing sports, or reading. Secondly, find a balance between life and work. Utilize family and friends. Most of us have vented to family and friends about a bad day. For some of us, this is a very good way to control stress. Finally, counseling. If you notice signs and symptoms of burnout in yourself or in a coworker, counseling may be the best intervention for this situation. Professional interventions to prevent burnout include: set realistic goals at work, learn from a negative interaction and then move on, take time away from work, and finally, seek support and give support for colleagues. Organization-directed interventions include advocating for adequate staffing and speaking with management about manageable workloads. Foster a team atmosphere in the workplace by supporting each other, being available, being flexible, and scheduling and receiving others' views on different issues, being competent, and being open to communication. Finally, create interpersonal relationships at work by having respect for everyone on the healthcare team and working together to improve client outcomes. This also creates an environment where we share the responsibility for patients, and which helps decrease stress of the healthcare professionals on an individual level. For resources other than those mentioned in these interventions, look up what your workplace has to offer. Windsor Regional Hospital's Human Resources Department offers a healthy work lifestyles program which has on-site facilities and exercise programs like yoga, Zumba, Pilates, and more. Windsor Regional Hospital also has a professional development program that exists for staff who are considering to further their education. Use a combination of all these interventions mentioned in order to reduce stress and prevent burnout for you.